Hi, everyone. Welcome to the first session, the first keynote session of the ICUDDR conference in 2021. I'm really excited about our presenter today, Dean Fixsen, PhD, is an implementation scientist. And I would say, actually, I have his brief bio, but I just want to say that he is really one of the fathers of the science of implementation. He really has done a lot of work around implementation science and defining what that even means. And so he's very modest about that, but I want to put that out there. I'm so pleased and proud to have him here. He has spent decades successfully replicating, developing, evaluating, and scaling up supports, and those became the foundations of the Active Implementation Framework, or AIF. He's led a comprehensive review and synthesis of interdisciplinary implementation research literature in the early 2000s that added to the evidence base for the AIF. And since then, Dean has led a proactive use of active implementation framework methods and measures to establish and study the development of implementation capacity in human services systems. I know, I've been doing this work for 20 years myself, implementation science, and I have always referred to the work that he's doing. And when he ran this organization called NERN, always went to his site for the resources. Now he has the Active Implementation Research Network, AIRN, and you can access that website. Actually, you can access it through the resources section of the ICUDDR website. So please join me in welcoming Dean Fixsen for the keynote presentation.
Thank you very much, Kim. It is a pleasure to be here and have this opportunity to speak with all of you. You have a very unique group, so it is a double pleasure to have the opportunity. And so today I want to talk about universities and implementation science and implementation practice. And as you see, my colleagues there, Melissa Van Dyke, Karen Blasi, Amanda Fixsen, nothing in implementation is ever done on your own. So there's always a team, and we will talk more about that as we go along. So I went to your website to look up ICUDDR, this international consortium of universities. And really interesting to see your goals, rapid improvement in competencies and skills among current and future generations of addiction professionals to meet the increasing demand for prevention, treatment, and public health services. And to this end, the ICUDDR facilitates networking among universities to promote high-quality education and training in the field of addiction, prevention, treatment, and public health interventions. So what an amazing group of people dedicated to a really important task. And so as soon as I read that, and knowing Carrie and Kim and the group that you have as leadership, this was clearly something that I wanted to participate in. So as I read those, though, being an implementation scientist, I immediately saw your goals are really about implementation processes and implementation outcomes, developing competencies to use effective innovations. That is definitely an implementation problem. Using effective innovations with fidelity and good outcomes. Are we doing what we intend to do? Are we producing the outcomes we want? Again, that is implementation. Establishing organizations and systems to sustain and improve outcomes. And so here we are again with implementation. So the fit between your goals and implementation science and practice, I thought was quite good. All of that fits into what we've referred to as a formula for success. I'm going to change this view so I can see more of everything, but I failed. Okay. Show thumbnail video. Here we go. So the formula for success, the three things, our first implementation failure occurred in 1971. So that was 50 years ago. And so 50 years we have been pursuing how to actually achieve socially significant outcomes. And these are the three big factors. And we have put this into a multiplication problem. So we need effective innovations, and a big part of the evidence-based program movement, as you all know, has focused on developing and evaluating innovations in our field. Effective implementation, that's a newer thing for many people, but that has really attracted a lot of attention recently, and the recognition that implementation is an important part of this formula. Enabling context, the rules, regulations, funding, leadership at national and regional levels, those things make a big difference as well. But when you have all three of these in play and they're doing their job, then we can achieve the socially significant outcomes that we are looking for. We will have drug demand reducing, not increasing. The thing with this is that we know more about innovations and context, and we know less about the implementation part. And we engage in the implementation part less often in a well-considered and evidence-based way. But the truth is, and you know this, people cannot benefit from innovations they do not experience. So if we don't help them implement these innovations in practice, then the recipients, the intended recipients, will not experience it. And keep in mind, this is a multiplication problem. So anything times zero is zero as an outcome, right? That's the math. And so not suggesting that's exactly how all this works in real life, but if the implementation part is weak, we will not be producing the socially significant outcomes that we all hope to achieve. And we think this explains the science to service gap and the quality chasm that has been much discussed in our field. Implementation science, if you look in the dictionary, dictionary.com is my go-to place to define terms, but to implement means to use. So if we're going to implement something, we want to use that something. So implementation science, therefore, it's the study of factors that influence the full and effective use of innovations in practice. The full and effective use of innovations in practice. And keep that in mind. We realize this definition of implementation science is a bit different than what you might read from other authors, but implementation is a thing unto itself, and the sole purpose is to generate the things in the middle of the formula for success so that we get the full and effective use of innovation in practice so that we can achieve those socially significant outcomes. Okay, good. So here's where the opportunity is for all of you. And this is where I was so excited to have this group, this international consortium of universities, be the audience, because you have tremendous opportunity. Implementation practice in science is a growth industry. If you look at where we are today and our understanding, our basic understanding of implementation practice in science, this is very much like the computer hardware, software industry when it was first developing in the 1970s. People had somehow in their garages and basements built the hardware. Bill Gates had a clunky machine and working on developing software. It was anything but an organized and smooth operation. But out of that came everything that we know today with computers and hardware and software and internet and so forth. But like hardware and software in the computer industry, implementation practice in science, that provides a platform. It provides the basis, the foundation that you need to enable all kinds of apps in the hardware or software industry but in our case, it enables the use of all kinds of evidence-based programs. Once this capacity, implementation capacity, is in place, you can start out with one drug dependence reduction effort, but once the capacity is there, you can more readily go to the second and the third and the 10th and the 20th. So the people who have done this find that the foundational parts have to be there, just like the basic hardware and software have to be there before you start adding in the apps. So it's generalizable. We think every school and a university really is a school of implementation. Just like every school and a university, with a few exceptions, makes good use of statistics. Why you would compute a mean and a standard deviation in business is different than public health, which is different than substance abuse reduction. But how you compute that mean and standard deviation is the same in every school. So we think implementation will have that kind of general capacity building in the university. Public health is all about building the capacity to make use of interventions for whole populations. So implementation, as it's built into a university, will have this kind of generalizable applicability. The other thing is, and we are finding this more and more, the big question that we get here at the Active Implementation Research Network, AIRN, where can we get the people? We're ready to go. We have money. We have opportunity. Where can we find more people like you guys who know this stuff? And the truth is that right now there is a huge shortage of people who really know implementation, practice, and science well enough to go make a difference. So students that you produce at the university, they will be in high demand. They will have great employment advantages when it comes to hiring in companies and in government and foundations. And in the end, they will contribute considerably to society. The other good news is for some countries where they are the United States and Britain and some of the European countries, Scandinavia, they're well on their way down these paths anyway. But for the countries that don't have all of those advantages, you have an opportunity. You have an advantage that you need to think about because innovations are embraced on the fringes. This is where the need is great and the status quo is weak. And that presents a great opportunity for you. And the reason for this is in many of these countries, the status quo is not currently supporting implementation as it needs to occur. They're not supporting implementation capacity development. Their funds are already sunk into and committed to other approaches to making use of innovations in practice. So to do things in a evidence-based way, implementation evidence-based way in established systems, that's more difficult. You have to overcome the status quo to do the work. But where the status quo is weak, you can build it from the ground up. Still, I have a lot of work. Don't get me wrong on that. But you have fewer impediments that are systemic that get in your way. So you have a tremendous opportunity to not only take advantage of, but in my opinion, you have the opportunity to actually lead the world in going down this path that we're about to describe. So don't think from a deficit point of view, think from a strengths point of view in your country and in your university. So what is needed? To do the work well, to make a difference, to have that formula for success, every one of the three components be strong. You already have a university base and a knowledge base that goes along with that. You in the International Consortium of Universities, you already have a mission that we started out this presentation summarizing that. You're there to reduce drug demand. You have a focus. You have something that can be accomplished. You know what the data are like now, and you want to reduce drug dependence. You're already doing the work in the field. You're doing technical assistance work. You're helping organizations make changes. You're already working with people, I'm sure, in the policy fields. So you're already engaged in much of the work at the frontline level. But lots of universities have these three things in place. They have this opportunity, and yet after 25 years, we still are faced with the science to service gap. So what is missing? And what is missing here is where I see the huge opportunity for all of you. So what is needed is a university, intermediary, laboratory, learning organization. And I'll talk more about that. But in this three-part organization, this allows double loop teaching and learning based on recursive feedback between practice and science. And we'll describe this a bit more. The references that I have built into this, this PowerPoint will be, a PDF of the PowerPoint will be available to you, and the references are included at the end. But these are terrific citations to introduce you. If you already don't know about recursive feedback, you will understand it better. But the quote from Sturman here, I think, captures a good part of it. Deep change in mental models or double loop learning arises when evidence not only alters our decisions within the context of existing frames, but also feeds back to alter our mental models. As our mental models change, we change the structure of our systems, creating different decision rules and new strategies. So a mental model is really our intuitive understanding of the environment. It's our intuitive understanding of what the problems are. It's our intuitive understanding of what solutions might be appropriate. But with the double loop learning, as you gain experience, the outcomes of our first attempts come back in effect. Well, gee, we need to think about this differently. We need to develop a different strategy. But it's the thinking about part, that's the mental model part. And so recursive feedback and mental models go hand in hand. But kind of keep this in mind as we talk about the next bit. So what is an intermediary? This thing between the university and the laboratory. An intermediary is an organization that works with provider organizations where frontline work is done. So you have the university, you have the work, and then you have the intermediary in between. But the intermediary puts theory into action. This is where materials are being developed we need to do this, and here's a meeting coming up, so we're going to need to develop materials to help people do this, or here are some measures that need to be established, and they don't exist out there in literature, so let's develop it and test the consequential validity. Consequential validity means that, yes, we have a measure, and it makes a difference. If we know this, we do a better job. When we don't know this, our job is not done so well. That's consequential. It matters. And also is a place where you can collect data to test and improve theory as you go along. You can make predictions and evaluate their outcomes. The intermediary organization in this conception also includes faculty and students from the university to support learning at a high rate. Because you're working as faculty and students, you are now working with the intermediary organization as they do the work with frontline people. So you're faced with real problems, real people in real time. It's not something that's an abstract thing that you glean from the literature. It's No, it's Charlie and Susie in the care organization over here. They are the ones who are facing this problem, and we, faculty, students, and intermediary organization staff, it is our task by the end of the week to solve this problem. So the reality of all of this is a real benefit to faculty and students. Another thing that comes from this at the university level, faculty and students really learn how to conduct applied research. You're doing this research not in a laboratory at the university environment. You're doing this in a laboratory out in the community environment. It's mission driven. You're going to solve these problems with these people right now. And so learning how to conduct applied research is another benefit. And how to develop, test, revise, discard theory. As you all know, there's a lot of talk about theory in implementation science. There's even the notion that implementation science is a science, which would be another topic for discussion at some point. But how do you make predictions and test predictions based on theory, and then the theory itself is modified based on the outcomes? So this intermediary is a very important addition. And there are intermediaries that exist, but not necessarily in the way that we're describing it here. So this double loop teaching and learning that we talked about, this recursive feedback, the opportunity to change your mental models. And here, in a very simplified way, we talk about university, intermediary, and laboratory. Universities have a long tradition of being the keepers and developers and the people to share knowledge. It's generalizable knowledge, hopefully. The laboratory, this is where skills, if you have a person who is going to be a practitioner working with people with drug dependency problems, that's a skillful thing. You have to skillfully use an evidence-based program or practice in order to produce the desired outcomes. The intermediary, then, this is where the competencies, the collections of skills that are related to knowledge, this is where all of that kind of comes together. The double loop part goes something like this. So in the beginning, when you're first starting this out, the knowledge flows from the university. Maybe you've done a search of the literature. These are the things that we need to do. This gets shared with the intermediary. They then say, well, we have two organizations that right now are ready to make use of this evidence-based practice. And it's our job as the intermediary to help them make full and effective use of that particular evidence-based program or practice. Remember the definition of implementation science. It's the full and effective use of innovations in practice. So in the beginning, you're taking what you know at the university, working with the intermediary to develop their competencies to then begin working with the folks on the front line. And too often, this is exactly where things stop. And so there are examples of this, and you know them, where yes, we work with the folks in the community. We have this organization that we're working with, and they in turn are working with people on the front line, which is a good start, but it's insufficient. It's not going to get you where you want to be. The critical thing for double loop is that the second loop means that the information comes back, and it comes back promptly. Okay, we took the knowledge, developed competencies, hope to be able to do the skill part. That didn't go so well. So what does that mean then for the intermediary? What were the problems encountered at the skill level there? And if so, what new knowledge, what new knowledge needs to be found or developed in order to improve this next time. So that's the first part is a single loop. The second part is the double loop. The key part for you and what we're recommending that you do from now on is that this gets repeated. Well, let's take what we think is our new knowledge now and apply that in the next iteration. What does that mean for the intermediary? And then you look at the skill level to see have things improved. And then you do it again and again. This is the life of a double loop teaching learning organization. This is what you want to accomplish. The first part of this, the knowledge, the competency, the skill with the university knowing what needs to be done, presumably, and sharing this with others. And if others don't make good use of it, it's like, well, I don't understand that. We told them just what to do and they didn't do it. That, again, the science to service gap is predominant. It's only when you take seriously the feedback, the prompt feedback from the skill area and the laboratory, and go back to the university and say, well, what else do we need to learn? What else do we need to do differently the next time? And then that gets tested. But you see how this works. And again, this goes on and on. I only had room for 4 of these, but it could be 400 over the course of a few years.
Tina, I have a question. So just to briefly interrupt and also just to remind people that if you do have questions, go ahead and write them in the question and answer box, and I will interrupt. The concept of intermediary, I'm wondering, like, is it a net? So the role or function might be necessary, but in like we have the ITTCs that we're working with that might fill that role, but is it something? Does it have to be another organization? Is there a way that you can have just the university, just the 2 sort of ends of the process and that function filled in some other way?
Yeah, great question. And I think the ITTCs are great candidates to perform the intermediary roles and functions. But it will require some changes. And so but ITTCs, I think, are a good candidate for that. The independent part of it we'll get to in a minute, but the intermediaries that are still tightly tied to a university, those have not fared so well, and we'll talk about some of the reasons for that. Some intermediaries are more closely tied to the laboratory part. Those have worked okay, but it has not generated the link back to the university to really develop the capacity that we're talking about here. So we think it needs to be a more independent organization, but highly interdependent, but administratively independent. And so we'll have some examples of that here in a minute. But Kim, feel free to monitor the chat box and interrupt at any time.
I will.
So just at this double loop part of things, universities traditionally and predominantly, this is where theory development, policy development, research methods, how you be the generalizable broad education that happens there needs to happen there. I don't know any place outside of universities where you really get that more complete, in-depth general knowledge development. In the laboratories, this is where the work gets done. How do you actually have innovations fully and effectively used in practice so that it produces the intended outcomes for the beneficiary? Working with implementation teams but the laboratory parts are not what a university does. A university does the general part. the laboratory does the specific part but again, it's real-time, real problem solving. So these are both necessary in order to produce socially significant outcomes. But just know that the things at the laboratory level are different from the things at the university level, but they have to fit together. They have to be integrated somehow or the other. And again, that's the role of the intermediary. Some examples, and I put in some references here to give you an idea. In Minnesota, in the United States, there's a Minnesota Department of Health. There's the University of Minnesota, and 30-some years ago, they formed the Health Partners Institute. And that is an independent, not-for-profit organization formed by the Department of Health in conjunction with the University of Minnesota. But Health Partners Institute is able to take the issues that the Department of Health is saying, these are the problems we're facing right now, and Health Partners, we need your help with that. And then they work with faculty and staff and students at the University of Minnesota, along with their own Health Partners Institute staff, in order to solve those problems. But that feeds into research, that feeds into program development, that feeds into policy, that feeds into everything imaginable. Another terrific example is in Norway. So the Ministry of Health and Care Services, again, 25 years or more ago, in conjunction with the University of Oslo, developed the Norwegian Center for Child Development. And Terry Ogden and the group there have done spectacular work. But again, it's what are the real issues being faced by the ministry, and then what can we at the university do to help solve some of these things, and what is it that the Norwegian Center then can do to facilitate this work. Other examples, the Teaching Family Model Research Group worked very closely with the faculty and staff of the University of Kansas. They did not have one entity like the ministry in Norway. They were working with several states and provinces. Similar thing with MST, multi-systemic therapy services for delinquent kids at the University of South Carolina. So to look more closely at what these intermediaries do, please look up these references. But these are wonderfully outstanding examples of what can be, should be done. But in each case, though, Kim, back to your question, these are independent entities. They are an organization unto themselves, and we'll talk a bit more about why that is. What are the advantages? Student education. So, student education. I looked up what is it that we want to have every student and graduate students in particular learn. These overarching competencies, skills of analysis, synthesis, balance and perspective, judgment, learning how to learn, forecasting, handling, and creating change. Johnson and Sampson said, this is, if you have a university, these are the things that you want students to come out knowing how to do. They are overarching, that they would apply in any circumstance with equal outcomes. Another thing is to develop professional virtues, diligence, tenacity, perseverance, patience, integrity. We want students to be professionals. We want them to have these virtues that are described by Sakaro and all. We also think students need to develop and come into contact with how you look at morals, what is good and bad, ethics, what's right and wrong, and judgment, when, where, with whom to do what kinds of things. And the opportunities to learn these competencies, these virtues, these morals, ethics, and judgment, these all are enhanced by doing this real-time, real work with real people in this university intermediary laboratory kind of group. So students get a big benefit out of this in these more generalizable ways. Faculty, and this what we do when we are looking at new things, we try to go back to when did that start? What were the issues then? Because usually that's when people were debating the very things then that we're debating now. So this is, as you see at the bottom, a paper written by Stanford University faculty in 1965, and this was in the middle of their interaction with the NASA folks who were building rockets and sending people to the moon. And so that was their laboratory, was the NASA part, and the university, of course, was Stanford University. But a university can participate in a meaningful way in the solution of outstanding, real-world, scientific and technological problems of today. It can act as a focal point for the development of a regional scientific technological, which we mean intermediary, while at the same time strengthening its role in graduate education and research. So here, Stanford University was saying by participating in taking on these real world problems, this really comes back and helps us redefine what graduate education and research looks like. They are talking about the recursive feedback. They're talking about changing their mental model. It can do this only if at least some of the professors, and there's probably an approximate critical number that must be exceeded, but these professors have a thorough understanding of both the practical and scientific aspects of their discipline and are responsive to the broad areas of interaction in their field with scientific, technological, governmental, economic, business, legal, and other factors. So, yes, this was a good thing from the Stanford University point of view. Not only were they helping develop the rockets to get people to the moon and back, but they were also developing their engineering program, which is where this came from, and improving that, and students and faculty benefited. But the kicker is that there has to be a critical mass of faculty who are able to do this work under these new circumstances. So this is a paradox, and this is something that you're going to face in your universities as you pull together the people to have this three-part learning opportunity available. So experienced faculty are required, but across the world, there are few, or in many countries, no experienced faculty in the university. So that critical mass that you need, those 3, 4, 5 faculty who know things well enough, know implementation, science, and practice well enough, in our case, to start teaching students, that part is missing. So you're going to have to create what you need as you do it. So get started, get ready, get started, get better is sort of our mantra. Yes, it's not there, but it's a goal that you have. So how can you get ready to do this? How can you get started doing this? How can you get better at it as you go along? And faculty and students then learn together, which is the goal of this in the first place. You want that interaction between the theory and the practice and the intermediary, making sure all of this is going to the benefit of both sides. But this paradox is an impediment. This is what is slowing down the development of the entire field of implementation, practice, and science at this point. And implementation, again, defined as producing those socially significant outcomes on purpose.
There's another question. It might be getting ahead of the presentation, but if that's so, you can just say, oh, I'm going to get to that. But the question is about the role of the laboratory in skills development. And it says, how do you implement communication skills between this sector and building the capacity of the university knowledge?
Well, that is a very insightful question. And those communication patterns are absolutely key. When we were talking back here a minute ago about these, the communication, right now, the notion is that university people will communicate with everybody else and the world will get better. That hypothesis has been tested, and it doesn't automatically produce intended outcomes. The communication comes with the feedback loop, the recursive feedback. But yes, the insightful part of that question is that sounds fine when I just say it in one sentence, but that is probably 6 months of debate, discussion to get it started, and another several months to iron out all the difficulties about getting the communication from the practice level to the intermediary, and especially from the practice level to the university staff. So that communication is critical. There is in the active implementation frameworks and systemic change on the website, you will find the practice to policy communication cycle, practice to policy communication cycle. And so that means from the laboratory to the university, in this case, communication cycle. But the information being delivered from the laboratory has to be done in such a way that the university people can understand it and have the opportunity to respond to it, so that in the next cycle, it's a constructive response. Things have a chance of getting better. So that is a terrific question and a big part of what makes all of this successful. There are many ways of going about that. The communication protocols that get established from university to practice and practice back to university, those protocols are established early on and revised as needed. So there are ways of going about that are pretty time-worn and effective. So we need the critical mass of faculty. We have the paradox of where will these people come from? And they need to be homegrown. We talk about the advantage of having homegrown people. And so, for example, Terry Ogden and the folks in Norway that we talked about earlier, they started out with their folks at the university. They were doing pretty much typical random control trial research, but they then started developing a broader group of people in that process. And it's that broader group of people who were highly involved that then evolved into the intermediary. But they had the faculty then who were teaching more students, who populated more expertly the intermediary, and they were able to do a better and better job at the practice level. So you see the synergy in this. But you have to start with what you have, get ready, get started, get better. An example of this is Saima Hamid from Pakistan. And I love when I was communicating first with some of her faculty, they called her worthy Vice Chancellor Doctors. And I love that. I mean, if there's a worthy person in the world, it's Saima. And to have her be virtually the Chancellor, Vice Chancellor of a women's university in Pakistan, I found that pretty brave in the first place. But Sima spent a year or more in preparation. So the get ready part, she and her colleagues who formed the beginnings of a team, they were getting prepared. But now she's getting, because she is the vice chancellor, and she sees the generic value of implementation science and practice across the various divisions and departments and schools within the university. She is really intent now on developing implementation science as a specialty. So the getting started, well, to get started, develop, and these are my recommendations to her. So we'll see how well all of this happens. This was all just a few months ago. But take it on yourself at the university to develop 3 courses. And we suggest 3 because one probably won't work and another one will falter. So you'll still be left with at least one that you will have a chance to make use of. But develop syllabi. Well, as you know, developing a syllabus for a course is pretty thought-provoking. So what should we teach and in what order, and how will we make sure that the students at the graduate student level will actually understand this? But you make your best guesses in the syllabus and then actually begin teaching and learning for the students. But to get started with something that does not exist yet, is poorly understood by the university in general. Faculty may or may not be in favor of all of this, but you'll find the 2 or 3 faculty who think this is a terrific idea, and they become good candidates then for teaching these first courses. And maybe you're going to have team teaching. You'll have 2 or 3 of your faculty who are going to be teaching one course. But this takes courage to initiate it and a whole lot of confidence that if we do this, it will get us started down the path where we can actually get this built into our university. Then engage students in projects. So faculty and students learn together. Now, these projects, where do they come from? In Sima's case, she is very well built into the public health and general health, but especially the public health system in Pakistan, and especially when it comes to maternal and child health. And so she has projects already that the government is asking for help to solve problems. So the projects are known. But the trick here, though, and the good thing here, it's not just faculty who are dreaming something up and trying to, you have the faculty and students learning together. How are we going to approach this? What is our plan? How can we go into this together? And this junior colleague approach means that the faculty are not like the gods and the students are like the peasants. These are equal. And so you're learning together. Let's go review the literature. Let's go to this organization and start doing a presentation on implementation and see what kind of response we get. But the junior colleague approach means that you really have a student there or a set of students who go with you to do all of these meetings and to help make these decisions. So the students and the faculty get exposed to real problems and hopefully real solutions and see the real benefits. But this does not happen at the university. This happens out in the community. You go to the clinic, you go to the neighborhood that needs some public health interventions. This is where the faculty and the students go there together to participate in that. So, but this requires a real commitment to community outside the university, not just the community inside. But that just gets you started. So to get better, this is where the recursive feedback, that second loop and the double loop you then take this information and say, well, we went into this meeting thinking, well, we'll just give them a nice PowerPoint presentation and they'll take in all the information and things will move to the next level. Well, probably not. It will generate way more discussion, debate. Early on, we were almost physically thrown out of meetings because they thought we came there to say something relevant, and they could not detect any relevance in what we were talking about. But it's not their problem, it's our problem. So how can we get better? What should we do differently next time? And as you learn that gets built into the next iteration then of the syllabus for a course. We neglected this whole topic on how to run a meeting with people who are not convinced. We neglected this whole thing on how to assess if people are learning anything in the training that we're providing. So how do we do pre-post assessments of training? So the course offerings then get developed and expanded. This is the mental model part. Well, we didn't think about it that way. Now we need to change our mind. We need to have a different intuitive feel for things. But the getting better, this will not happen after the first, second, 10th, 20th time that you do these things. So this longer term view, we are committed to this, which is the courage and confidence in the first part, and we are going to make this happen. We're going to get better and better at it. So we are getting people ready more quickly. Students are learning more quickly. Our courses are more and more relevant. But you just see how this can function. But this is not typical university operations. So of course, we all want these things to happen, but it's the feedback that we were talking about a minute ago with the insightful question that feedback has to be coming back very promptly. But because faculty and students are directly involved in this at the intermediary level, and again at the practice level, the laboratory level, the communication is pretty real. They see it, they feel it. They were embarrassed when it didn't go well. They're proud when it did. Those things come back and make a big difference in the curriculum. So Simon is really quite taken with all of this and wants this to happen. But as these happen, then your faculty gets better at this. They are learning more and more about implementation. Your students are learning more and more because your faculty are better at teaching it, and the students are having the opportunity to practice in real time, real opportunity kind of situations. So what makes this work? You need the essential link among the three components of this. And this is where we think the active implementation frameworks come into play, because they are the proactive. They offer guidance. They are evidence-based approaches to having the full and effective use of innovations in practice with socially significant outcomes happen again and again. So this guidance function of the active implementation frameworks is a very important thing. And it's important because it helps to integrate what it is that is going on in the three components. So it's a guide for curriculum development. It's a guide for research. Where is the next prediction coming from? Well, the active implementation frameworks are a intermediary theory of implementation. And there are many, many predictions that are embedded in the frameworks. So that's at the university level. Guide for competency development at the intermediary level. Well, what competency should we develop? Well, it says here in the active implementation frameworks that we have to start with a usable innovation. So let's start there, trying to develop the skills, the competencies that we need to assure that we have a usable innovation, just to take an example. And it's also a guide for delivery and evaluation of effective services at the provider organization, the laboratory level. So, but can you imagine, and again, why do we have the practice to policy or practice to, why do we have the science to service gap? It's because these things are disconnected when other universities and other groups try this. The university has one view, the intermediary is something else. The effort at the service delivery level is a third thing altogether. And so, but these things have to be integrated. And the active implementation frameworks are a good way to integrate all three of these. So everyone is operating from a common point of view. And not going to go into any kind of detail on this, but the active implementation frameworks here, usable innovations, what makes an innovation teachable, learnable, doable, accessible, scalable? Well, usable innovation criteria, once they are met, help accomplish all of those goals. Implementation does not happen all at once. So what are the stages and what are the relevant stage-based activities that need to be there? Implementation drivers, the critical, the heart of all of this is how do you change behavior? How do you have practitioners learn innovations? How do you have managers and directors learn how to make changes in organizations to support all of this? How are implementation teams developed and how do they operate in organizations? Implementation teams are the missing implementation capacity. And I think this is where the ITTCs, you have the beginnings of that already. Improvement cycles. Everything that we do starts out to be barely adequate. I mean, it's get ready, get started, get better. That whole thing is an improvement cycle. The recursive feedback that goes to and from university to the practice level, those are improvement cycles. So how do you do that in an efficient and effective way? That is what's outlined there. Systemic change. How do you create the enabling context that needs to be there to make sure that implementation capacity is being developed, implementation policies and rules and regulations and funding requirements are there to support organizations. So, but if you look at this from a university point of view, all of these things are a lifetime of research. Your faculty will have no shortage of research topics to keep them highly involved for the rest of their careers. Students are going to be learning this not only in the classroom, but in the practical applications. But again, these are the links. These are the things that integrate the three levels. Right now, letting it happen, helping it happen, making it happen. Diffusion, dissemination, implementation. So the letting it happen, Ev Rogers and diffusion theory, that is probably the best known of any of these, and been around since the 1960s. Helping it happen, dissemination, having manuals, websites, public service announcements on radio and TV. We've seen how much of this in the whole COVID crisis and trying to get people to wear masks and social distance and so on and so on. But dissemination is a good way of getting information to people. And most of the technical assistance centers that we have encountered in almost any field, dissemination is probably the 90% of all of their activity. Making it happen. This is where, again, the full and effective use of innovations in practice. But here, the innovation team becomes responsible for outcomes. We're not just talking about it in diffusion. We're not just helping people understand it better in dissemination, and it's up to the users of the information to make it all work. Here, implementation teams are going to make it happen, not in a negative, harsh way, but by purposeful and proactive use of implementation, practice, and science. Here are the implementation drivers, one of the active implementation frameworks. But as you can see, here are the things that over the last 50 years have reliably come into play. Innovations are new, so competency drivers are there to help people learn very quickly what it is that they need to do, both as a practitioner and as a staff person supporting a practitioner. Organization drivers, especially facilitative administration, where the rules, regulations, policies, procedures, typical ways of work, all of those things are going to be changed in one way or another when an innovation is being used reliably. Leadership drivers, the technical adaptive leadership that needs to be there. But all of this means that you are able to support behavior change. You're able to support sustainable outcomes by design, not by default. Right now, we hope for the best. But here, with implementation teams highly involved in making use of these drivers, now the team itself is accountable for making sure all of these drivers are in place so that high fidelity performance can be produced. And with high fidelity performance, that means we have consistent uses of innovations. 80% or more of every single practitioner who goes through the selection training, coaching, and has supportive organization and leadership, 80% or more of them consistently use innovations. And because they do, you get reliable benefits for beneficiaries. So this is a way then to make sure that the innovation that you've adopted to reduce drug dependence is going to have an effect on a broader scale. Here's some examples, and I'm going to shorten this part up. But treatment of heroin-dependent women meeting criteria for borderline personality disorder, dialectical behavior therapy, a well-known, well-established, evidence-based program. But here we have low fidelity and high fidelity. So all the therapists in these two groups had gone through dialectical behavior therapy training and got some kind of supervision. But when they looked at outcomes, the therapists who were using dialectical behavior therapy only a little bit, 30% of those people of the outcomes then were generated by low fidelity. But the people who are using dialectical behavior therapy fully and effectively in practice, then 80% of the women that they worked with were free of drug abuse for the year. So fidelity makes a big difference. So that's why at the top of the implementation drivers triangle, fidelity is the key. It's the link between doing all the drivers and between that and accomplishing the purposes that you want. And the purposes you want here are here on the high fidelity side. I'm going to skip. Well, just so you know, this is the BEMONC, which is Basic Emergency Obstetric and Newborn Care, BEMONC. But the fidelity score was 4.3 on a 10-point scale. They intervened and got the fidelity score to 6.7. This is 134 centers, 91 districts in Ethiopia. And as fidelity went up, then outcomes improved substantially. So it's not only that fidelity makes a difference, it's also you can improve fidelity by improving the implementation drivers. Sustainability. So eradication of smallpox, just to talk about this briefly. This is the only disease that we have in the world that has been eliminated. There were 50 million people with smallpox in 1950, and by 1979, there were none, and there have not been any since. So this is the most successful implementation and scaling up effort ever conducted. But William Fage, who's a leader of this big group from CDC and the World Health Organization back in the days where they were doing this, he said, we need to go from asking, what can we do with what we have, to asking, what will it take to do what needs to be done? And that's really what we're talking about here. Yes, let's get started with what we have, but we need to really think, okay, what really needs to be done? And that has to become then our goal. It is mission driven. We're not just looking at barriers and outcomes and documenting them. We have barriers that we have to overcome. And their surveillance and containment methods that they develop, which is their version of a usable innovation, they were able to do this in India and in many other countries until they eradicated. But India was the hotbed of smallpox in the day. But national, state, regional, and block implementation teams were developed by the groups. And these were lots and lots and lots of these implementation teams that were linked. But here again, they had the many universities who were contributing along with the researchers at WHO and CDC, but they had this group of people who were the intermediaries who were really making all of this happen. And put a reference at the bottom. We summarized all this from an implementation point of view. The thing, when you get to the practice level, you have the intermediary. How do you get all of these things integrated? How do you work at various levels? And again, from a university point of view, think about the research opportunities, think about the knowledge development opportunities, because the intermediary team is not only working with you at the university, they're working at the practitioner level, developing staff competence. They're working at the organization level to improve the supports for practitioners doing this new work in these new ways. Community supports. Do you have the flow of people? Are you getting the support you need from community in whatever way is required? And then regional and national system supports. So the accreditation, certification, funding, blah, blah, blah. You have many, many things that impact the ability to do all this. But this is not handing something off from one group to another as you go through this progression. It is the intermediary team. They're helping to see that each of these things is done, and it's done with the active implementation frameworks in mind. So when we talk about integration, that is part of what we're talking about. When you look at this from the opportunity for faculty and students to learn, think of all of the learning that's going to go on. Do we know enough at any of these levels? No. So the opportunity for learning, for teaching, for the junior colleague, faculty, student groups to wade into these problems and figure them out right on the spot, that is a wonderful thing. So here we are at the end. There are big issues to resolve. And university administration, at least, and yours, I hope, is way better than the ones that I've experienced. But they're slow and cumbersome, and lots of decision-making by all kinds of people and forms to fill out, blah, blah, blah. That is a very poor fit with the need for this flexible kind of work that needs to be done. if you are needing to do interviews with people who are in a low-income area, and you need, I'm going to say $25 that for each family that you want to interview as a payment for their time, and you need it by Friday, is the university going to be able to respond to you and, God forbid, hand over cash? That is a very difficult thing. But just to know that fit between the need that you have when you're dealing with the intermediary, when you're dealing with people at the laboratory level, universities are either going to have to change what they do, or you're going to have to work out a different kind of arrangement. But when we were talking about why do you need an independent intermediary, this is in part why. The independent intermediary can be as flexible and entrepreneurial as you need. The other thing that university people have difficulty with is that contracted work, where you're contracting to help this intermediary go make a change right now with these people in that organization to benefit these particular recipients. They have deadlines, there are deliverables that have to be met. And again, this is a poor fit with the slower, more thoughtful approaches in academia. Work in community settings where implementation happens. How does that go when the meetings are at night? The meetings are in a clinic in the early morning before they open. The meetings are in people's homes at their convenience. How does that interact with teaching classes and taking classes if you're a student? And they're Tuesday and Thursday at 10 o'clock. So again, a not a good fit, and that needs to be resolved. And there's this professional view with scholarly goals, and we run into this in every university we've worked in. This is not what professional faculty do. I did not go to school all these years to get a PhD and teach and be a full professor or an assistant professor so that I'm going to go out there and work with frontline people. So the hands-on daily work, frontline people in organizations is sort of beneath some people. And we always find the people who don't mind that and actually see it as an advantage. But the professional view part of it is something that we still have to deal with and placate people so that they allow this frontline work to happen in the university setting. So make it happen. It's your job now to go make this happen. So the wonderful thought from Fixsen, the resources needed to perform institutional work are created through the enactment of practice. So this is the get ready, get started, get better. And as you go along this path, you start to disrupt the status quo in the university. You start to disrupt the status quo in the systems that support this goal of reducing drug dependence. So, and it takes a while to get all this accomplished. So don't wait, start now, learn by doing, and develop your own capacity. Have more homegrown students, have more homegrown faculty. The second generation of faculty 5 years from now, they will be the students who graduated from your university. You then will hire them as the next faculty because they will know more than any of us about how to make this work, because that's how they grew up. So it's an interesting journey, and I hope many of you really, really consider this. This is badly needed, but for those of you who step out first, who really take this on and start to enact this plan in practice, you will be the leaders globally in implementation, practice, and science. And I am looking forward to the day when you call me up and you say, hey, we did it. We had our first group of people graduated, and here are the work that they're doing to solve the real problems in our country. So thank you very much.
Thanks, Dean. So I just want to remind people, if you have questions, we do have a few minutes before we're done. Please post them in the question and answer section. One question that comes up with a lot frequently is this sounds sort of complicated and maybe hard to do with low resources. And you had the quote from I think Dr. Fage about we need to get the resources that we need to think about what the resources. So can you just address that whole resource issue a little bit in terms of, so we have low resources. If we're successful, maybe we can draw more resources to what we're doing, but how do we even get started on this path?
You asked the most interesting question. So that is a problem. So, but we have, we can only think of one exception right now, where the country or the large system that we were engaged with, they are already engaged in improvement efforts of one kind or another. They're trying to improve, the infant survival rates. They want to reduce maternal mortality. They want to have students learn to read when they go to school. So they already have invested money in those efforts. So getting access to the folks who are close to that decision-making role, it's starting to talk to people who are the aides, the third level down in the bureaucracy, getting them to understand that formula for success, what's missing from their efforts. There's no poor intention on anybody's part. Everybody wants things to be better. The problem is they're spending money on things that don't work very well. They never have, and they never will. And so part of our education, gently, is to point out to them, you're using an evidence-based approach to this problem, and the evidence says it does not work very well. Now, you can go on and replicate that one more time, and again, we do this in a gentle way, but it's to get people then to start considering it. We're back to that mental model. They need to start thinking, well, what if we try this? And if you get them to attempt to try it even in one city or one neighborhood or one part of the country or one whatever, that gets your foot in the door. But this is where the learning then needs to be pretty rapid, and the learning needs to include those decision makers in it, because eventually, in a year or so, you're going to be able to produce at least as good outcomes as they have done in the past, and chances are much better, and show them the path for doing this better and more frequently and more broadly. But it's again, getting started with what you have and then having the opportunity to expand it.
Yeah, I think about even just, one classroom, one faculty member with their classroom students working with one organization and trying to, just starting with that feedback loop in a really small way, maybe to demonstrate or to create the evidence that can make it grow.
Yep. And in the TTCs, this is again why I was pretty excited about this group. You already have people who have resources devoted to all of this. It's really the connection then. The TTCs are in the middle in that intermediary role, more or less. They're already working with people on the front line. They're already attached to a university. So the funding is there, the opportunity is there. It's just, it's renegotiating how are we going to do our work? But even there, you don't stop doing everything you've ever done as a TTC and do it this new way. You can take some part of that and start doing it in the new way.
Right.
But it's so you always start with what you have and then work from there. The interesting thing was that even in the refugee camps in Jordan, they had, or in not Jordan, Lebanon, but even in the refugee camps where I was kind of saying, gee, I'm stumped. But there were international groups with devoting considerable funds to what was going on. And again, not doing it in the most effective ways, but that's coming along. So anyway.
I mean, one of the things I think is a struggle around this resource issue is whoever's funding what we're doing, whether it's the university that's supporting the class, or whether it's the government funding a program, we count numbers, right? We count like the number of students that graduate from your program, or the number of trainings, the number of people that are trained in your continuing education class, or and it's much. Everybody wants outcomes, but the process of both of getting to the outcomes, but also measuring the outcomes and making the links between those steps to the outcomes is kind of complicated, right? And so that winds up being an issue, I think, as well, in terms of how do I know that this thing that I'm doing, I mean, you showed some great results from your case studies, and I guess I'm just thinking, like,
yep.
How do we get people from counting heads, basically?
Well, that you're touching on the regulatory part, that whole enabling context part of things. And right now, they are enabling the head counts. They are enabling, how many trainings did you do without counting what are the benefits of that. And so part of the intervention that needs to be there, and again, faculty, students, intermediary staff, what's the best approach for convincing the policymakers and the regulation makers that they need to change that? So that, yes, we want to know how many went through the school or how many went through the training, but we also want to know, did it make a difference? So consequential validity of any assessment is a big deal, but they don't know that. So part of the education that we have to provide is about what are the metrics, and what we work on from the very beginning is fidelity. And we teach the policymaker and the regulatory people about fidelity. And if you don't know fidelity, you really have no idea what you're getting for the dollar. And right now you're spending a lot of money to keep trainers employed. You're not necessarily spending a lot of money to have the people benefit from the training. So it's a slower process in some cases, but getting them to try it a little bit again, so that they too can see the results of doing things differently. But
thank you. I'm going to make a last call for questions. I don't see any new questions posted. I'll give it a minute. Dean, do you want to have a final word before I close?
What I've talked about today, as I started out saying, I felt like we have here the perfect audience, because you already are engaged in so many parts of this three-part effort, where you have the university, the intermediary, and the practice level all going on. And this reflects a lot of your own work. But it's how we go about it, and having that intermediary truly be an intermediary. And I think this is where the technical transfer centers are really in a good place. But to have you be reasonably independent from the university, so you're not stuck with all of the rules and regulations they have, although your university may be better than any of mine, and to have you be in a position of having a close relationship with the people who are actually getting the work done. But once you sort out those things and then establish the communication, close communication that someone was asking about earlier, then you're on your way. But what people have found is that once that three-part sequence is set up, the learning is rapid. It's learning at the university level, at the practice level, and at the intermediary level is rapid because the feedback from making a good decision is right there, and the feedback from making a poor decision is right there. But it's no fault, no blame, and we all learn. But I wish you well.
Thank you. So everybody, thank you. I hope you can join me in thanking Dr. Fixsen for his great opening presentation for our conference. We are going to go into our breakout sessions in about 15 minutes. So you have a 15-minute break. And then we have a couple of breakout sessions. I think one's in English, one's in Spanish. And so go ahead back to the main entry room and you can switch to the next session. Thank you so much.
Thank you.